Millennium Development Goals. These goals were established by United Nations in 2000 as all 189 nations from UN gathered together in order to free people from extreme poverty and multiple deprivations. People, through these goals, aim to achieve 8 different international development goals. 1. Eradicate extreme poverty and hunger. 2. Achieve universal primary education. 3. Promote gender equality and empower women. 4. Reduce child mortality. 5. Improve maternal health. 6. Combat HIV, AIDS, malaria, and other diseases. 7. Ensure environmental sustainability. 8. Develop a global partnership for development. Each of these 8 goals had specific targets, sub-goals, and dates for achieving those targets.
As of 2013, progress towards the goal was uneven. Some countries achieved many goals, while others were not on the track to realize any. A UN conference in September 2010 reviewed progress and concluded with the adoption of a global plan to achieve the 8 goals by their target date. New commitment targeted women's and children's health and new initiatives in the worldwide battle against poverty, hunger, and disease.
Among the 8 international development goals, our chosen goal is the 4th one. Goal 4 is reduced by 2/3 between 1990 and 2015 the under 5 mortality rate, where mortality rate means the number of annual deaths per 1,000 lives. More specifically, this goal aims to reduce the child mortality rate, which was 93 children of every 1,000 dying, to only 31 of every 1,000. The number of children dying each year decreased gradually thanks to our development goal. In 1990, 12.4 million children died annually, but after the start of this goal, the number decreased to 8.1 million in 2009. In 2010, 7.6 million, and in 2011, only 6.9 million kids couldn't avoid deaths. Recently, in 2012, 6.6 million children passed away.
At first in 2000, our goal sounded somehow unrealistic. Some said that the executive directors of UN were underestimating the true global situations on child mortality. As you can see from the figures, Sub-Saharan Africa's statistic for under 5-year mortality rate was 177 deaths per 1,000 children in 1990, while in Southern Asia, 126 deaths per 1,000 were occurring. And as for the overall average, it was about 90 deaths per 1,000 children. The massive number of children dying each year made the goal sound impossible to achieve.
However, it was revealed that of the estimated 10.5 million children under 5 who die each year, the vast majority, which is more than half, die needlessly from preventable or treatable diseases and conditions. This fact made us feel regrettable and more desirable to choose this goal to investigate. In detail, many newborn babies die because of unsanitary conditions they are living in. Malnourished children have a higher risk of deaths from common childhood illness such as diarrhea, pneumonia, and malaria. Such nutrition-related factors contribute to about 45% of total children's deaths. All these diseases can be easily prevented as there are already enough cures for them. If people can pay attention to this serious situation and help those children facing deaths by funding, the children will survive easily. In the sense of how all the causes of child mortality are preventable, if there is great effort and attention, the goal to reduce child mortality by 2/3 before 2015 sounds plausible and achievable.
As for the global distribution, over 70% of all under 5 deaths occur in Africa and Southeast Asia regions. Children in Sub-Saharan Africa are over 60 times more likely to die before the age of 5 than children in developed regions like North America and Europe. There are several reasons to why only certain regions have especially high mortality rate for children. Children born into poverty, mostly from developing countries, are almost twice to die before the age of 5 as those from wealthy families. This is because children in poor condition cannot get proper vaccinations, medications, and nutrition that are essential for human survival. Education is one of the important factors too. Women in developing countries cannot get educated enough to know how to take care of children safely. They don't learn about usage of contraception, which is essential for them who cannot afford to raise children with responsibility. For these reasons, some extremely poor and isolated regions are far behind in achieving the development goal.
Throughout an almost decade, action efforts to help achieve the goal have been very active in many parts of the world. For instance, United Nations Developing Program, which is the main director of the overall plan, donated money for Afghanistan with around $920 million and for Argentina with about $550 million. Several progresses made by actions of the various organizations have also been gained. UNICEF has kept on supplying a large amount of vaccines for measles, flu, pest, and other various diseases around the globe. In particular to the measles, since 2000, measles vaccines have averted over 10 million deaths of children.
Some nutrients like vitamin A, B, and D, and water supplies are continuously donated and sent to the African region by many organizations. UNICEF and WHO are currently trying to educate women in developing countries with high fertility rate like in India. These activities gradually increase child survival.
In spite of large population growth throughout years, thanks to these great efforts, the number of deaths in children declined from 12.4 million in 1990 to 8.1 in 2009 and 6.6 million in 2012. This means that 8.4 million fewer children die each year compared to 1990. Despite this amazing progress in achieving a goal, more than 3 million children still die of treatable diseases every year. To reach our goal, we need to save about 2 million children more. At the moment, we have about 1.96 years left till our target date, which is 2015. If we can keep the same pace in accomplishing our goal, we will succeed for sure. We got all this information from this website. And this was Hanbyul and Junghoon. Thank you for watching.